Thank you so much for joining us today. I want to start off by introducing myself as the new program director for Helper PRG. My name is Judan Heath, and I am very grateful to be here. I'm a mom of two small boys, and as a working parent with a background in political advocacy and community engagement, I'm always seeking and excited to learn new strategies, methodologies, and skills for caregiving. And so Helper fits right in there. I'm excited to kick off my first PRG event with this month's CPR and Saftey Session that has a focus on head injuries and concussions. For those of you who aren't on a Helper's benefits plan or don't know about us, we at Helper provide parental support and solutions that are subsidized by employers. This includes a range of services such as backup childcare, financial assistance, primary childcare sourcing, online socio-emotional courses, and also a new FSA tool to help access those funds with in-home care. We'd love to share more if you ping us in the chat or reach out. We would love to reach out to you about your own benefits to learn more. You can also always email us at hello@helper-app.com. A little housekeeping, our new schedule for April will be going live online, helper-app.com/PRG. This afternoon. The PDF is located in the chat with a link to it, with all the links to sign up for April sessions. It has all kind of programming listed, as well as free community kid classes. Some highlights for next month include 2 unique sessions with infant and child sleep specialist and co-founder of Battelle Sleep School, Miss Megan. Session 1 for newborns on the 13th at 11 a.m. is entitled How to Approach Sleep with a Newborn or Young Baby. And on the 15th at 11 a.m., both times are Pacific, What to Do When Your Toddler Just Won't Sleep. That's one I'm going to sign up for. We also have our regular whole brain care planning and CPR sessions as well that are continued monthly. And so without further ado, I see some people have joined on. Becca is online with us as well to help, and please feel free to put all of your questions in the chat. Our April programming is there if you just joined us. I'm going to now introduce our resident CPR and safety instructor, Kim Murray. Kim is an RN, has a bachelor's degree in mathematical science and a master's degree in nursing, clinical leadership. She loves teaching and has taught at prestigious nursing schools, such as the University of Maryland and Johns Hopkins University. She has worked for the American Red Cross and was a nurse at the U.S. Naval Academy. She brings a wide range of experiences as our medical educator, and we're so grateful to have her. Again, feel free to add your questions in the chat as we go along. And so I'm going to hand the mic off to you, Kim, and put myself on mute, and we're here to help.
Okay, thank you so much for that great introduction. Like she said, my name is Kim, and I'm going to get started sharing this presentation with you. I work for the DISC Foundation, and let's just give it 1 second here. We are sponsored by the Save a Life initiative, and as she mentioned, I'm a nurse, and if you can tell from where I've worked, I live in between Baltimore and Washington, D.C. I'm in Maryland, and so it's been great now to work online. This company is 100% online internationally anyway, and their whole foundation of the whole purpose of the foundation is to empower others to save lives. So we provide free healthcare education all over the world. I have lots of international clients, and any topic that you would like, that's what I'm here for. So it's a lot of fun for me to be able to combine my teaching and nursing and help out this way. So we do have a goal of empowering 10 million people, and we do keep track of everybody that signs up. So we're on our way towards that goal. So today we are going to start with a brief overview of child and infant CPR. And so if you tune in every month, we're going to see this overview and then also have a special topic every month. So hopefully with your repeated exposure to these topics, this will really stick, and then you'll have that there in your brain if you ever need it, which hopefully you don't. But the reason, of course, that we learn CPR is to help save lives. In the United States, we've had 300,000 people in a year have a cardiac arrest outside the hospital. That includes adults. And the survival rate is only about 10%. So that's not very good. It's not as high as people think. And then in the hospital, of course, it's a little bit higher because we have all those skilled professionals around, but it's still only about 20%. So studies have shown that definitely if we can intervene right away with immediate CPR, we can really improve that victim's chance of survival. So we want people not to hesitate to act if they need to. Along with the American Heart Association, our goal is to increase that rate if we can go up over 30%, even to 40%. So of course, there's lots of fears about doing CPR if you've never done it before. We do want you to be careful of the scene, to like actually physically look around and see what's going on. Take a few seconds before you just run in. We don't want you to become another victim. Make sure that the danger has passed. Fear of disease is very relevant with COVID-19 right now, but studies just in the year that we've had it and been responding to it as first responders are showing that the rate of transmission is actually the same for our first responders as it is in the community. And most of our first responders are vaccinated now, since that started in January. So we're hoping as we get more vaccinations out, that'll help. But basically, you want to be using your PPE if you are helping a stranger. So gloves, mask, gown, if you have it. We are no longer doing mouth-to-mouth CPR because of the risk of disease on a stranger. You can, of course, choose to do that on a family or loved one. For liability in the United States, we do have the Good Samaritan law, which protects any bystander if they are attempting first aid or CPR, even if they don't know how to do it. You can even be instructed by the 911 operator and just follow what they're saying. And this law protects you that if you would be named in a lawsuit, you would not be held liable. And lots of other countries have similar laws. People are afraid that we would hurt someone or you don't know what to do, but we're hoping as you continue to take training and refresh your skills, you'll understand that doing nothing just is not a good result. You know, they will not survive that. But if we can intervene, there might be some bruising or things like that, but it's not going to be a big deal and they will heal. So for pediatrics, this is our chain of survival. So we're following these steps if there's ever a problem. You can see from the first one that prevention is the key for children and infants. We want to, excuse me, always have a safe environment and prevent any accidents from happening. But if something does happen, of course, we're going to call 911 right away. And if the child is unconscious, we need to get right in there and start CPR. Starting with chest compressions, and then you can see those last three steps, the advanced life support, post-cardiac care, and recovery. Those are handled by our hospital staff. So we're going to just focus on prevention, calling 911, and starting CPR. So what is CPR? It is cardiopulmonary resuscitation. And so we are combining rescue breathing and chest compressions to support the heart and lungs when they aren't working by themselves. We're literally pushing on that chest bone, which is compressing the heart, which is squeezing the blood. There's already oxygen in the blood from the last breath that they took. And we want that oxygen to get to the brain, okay? So with children, they are more likely to have a respiratory problem. So that's what you're going to look out for, which is choking, asthma, allergies, anaphylaxis, drowning, pneumonia, COVID, respiratory illness, that kind of thing. They're, of course, not likely to have a heart attack from, plaque or unfit lifestyle, things like that adults have to deal with, or, genetics. It's just not going to cause a heart attack in a young child. So we're going to look out for those respiratory problems first. So children are classified as basically that toddler age, 12 months. Can they walk? Are they standing up to teenager? Once we get into a teenager and a child has gone into puberty, they don't have to be through it, but started puberty, maybe they're over 100 pounds, definitely by high school, basically, they're going to count as an adult for CPR purposes. So for children, we're checking that the scene is safe, checking to see if they are okay. We just tap their shoulder and shout really loud, "Hey, are you okay?" And if you know their name, you yell it. Check to see if they are breathing normally. Uh, and this is assuming they're unconscious. If they were responsive and moving around, then we can just call 911 and stay with them. Don't leave the scene. The rest of this goes if we check to see if they're responsive and they're not moving or breathing or responding verbally or anything. Then you have the choice of, do I call first or care first? If you have your cell phone or another person is there and you can just call for help while you're moving through these steps, this is when we do it. If for some reason you were out on a hike with no phone by yourself or something like that, or you don't have reception, you do need to stop and do CPR first before taking, 30 seconds to run somewhere and call 911, meaning that those first few seconds are just crucial because of children having respiratory arrest, which leads to cardiac arrest. We need to get that CPR going right away because lots of times they can just come back very quickly with that. If we take a break and run into a building to call for help, you kind of lose that window. So that's very important there. We're going to continue doing CPR for at least 2 minutes. The rate is 15 chest compressions with 2 rescue breaths if you're going to do rescue breaths before you would have to leave to go call for help if you have to. If you've already called, they're on their way, and so everything's good. If there's an AED around, you can get that and just turn it on and do what it says. They're very easy to use, but we're not very likely to need an AED on a child. But you're going to keep going until help arrives or you see signs of life, the scene becomes unsafe, or you're too tired to continue. So I'm going to pause here and show you a video, and then we'll come back and review that.
Can you believe they're catching the game last night?
It was amazing. I thought it was over. I was ready to turn the TV off and go to bed.
Yeah. Well, they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. I think we should break out some scooters on the way to work.
I could definitely see you breaking something on one of those.
Yeah, you're right. Hello? I gotta get to the office.
Me too.
All right. Yeah. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Joey, are you okay? Help! Help! Someone help my son, please! Joey, are you okay? Oh.
Joey, are you okay? Joey, are you okay? Call 911. I just get an AED and first aid kit right away.
Yeah, we have those at the store. Joey!
It's okay, ma'am. He's on the phone with 911. Did you see your son fall?
It all happened so fast, I'm not even sure what happened.
Did anyone else see what happened?
Yeah, I saw the whole thing. He just collapsed out of nowhere.
Was your son complaining about not feeling well earlier today, or?
He said that his stomach hurt. I said we shouldn't go, but he really wanted to ride a scooter. I should have made him stay home.
Does he have any allergies?
No, he has no allergies.
Thank you so much.
Okay, so that one is showing us recognizing an emergency and responding and just not being afraid to act and saying, "Hey, are you okay?" And now this child was responsive, so they moved around a little bit. We're still calling for help. We're still telling other people to get help or get a first aid kit and staying with that child until help arrives, till the ambulance comes. So The next one is going to review CPR itself for you, and then we'll move on and talk about head injuries. For this one, we're going to look at infant CPR, and then I'll explain the differences between child and infant.
Unresponsive and not breathing. If an infant is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the infant is on her back on a firm, flat surface such as the ground.
The baby's unresponsive.
Next, stand or kneel to the side of the infant and place 2 fingers on the breastbone just below the nipple line with your hand closest to the infant's feet. Now, give 30 chest compressions. Using the tips of your fingers, push down about 1.5 inches and then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. After the 30th compression, prepare to give 2 rescue breaths. First, place a breathing barrier over the infant's nose and mouth. Then, open the airway by putting 1 hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a neutral position. Make a complete seal over the infant's nose and mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. You have performed 5 sets of CPR, you are alone and need to call 911. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
Have the AED and the first aid kit.
Okay, and you will notice on there that they mentioned 30 compressions and 2 breaths. That is what the rate has been for the past number of years. Every year, our International Committee on CPR and our American Heart Association, they review the standards. They did just change it in November of 2020. And this is a Red Cross video. They haven't updated their text yet, but you'll see on our website, which I'm going to share with you, we've updated it and people are working on updating that. So let's go back and just look at, we had children, you're checking the scene, checking for responsiveness, calling for help. The ratio is 15 and 2, and just keep going. For infants, the differences would be tapping the bottom of the foot. So you want to, take the clothing or sock off, just because they're so squishy if it's a very young infant or newborn. Same order of things, check and see if they're breathing, calling for help, 15 chest compressions, 2 rescue breaths. For an infant, if you would be doing the mouth to mouth, like they had the film barrier, you can get these plastic barriers. They're very cheap. You can order them. It says CPR mouth to mouth, plastic film barrier. They have a filter. So this will protect you from any viruses because you're going air in, but the air is not coming back at you. So if you are doing CPR on an infant, you have to cover their mouth and nose just because they're so small. A child, you could pinch the nose, and an adult, you would pinch the nose. So everything else there is the same for infants. For adults, we do the 30 and 2 ratio. And again, if you're in the heat of the moment and you just can't remember, it's not going to be essential that you remember which number is which, or if you call 911, they are going to be able to tell you exactly what to do. So just looking at the details of chest compressions, you're going in the center of the chest, 100 to 120 compressions a minute. We think of that Staying Alive song from the 70s, the disco, if you remember that song. And the depth is about 1/3 of the chest. So if you're looking at your person from the side, they're laying on the ground, we're just trying to go down, not halfway, just to the top third. Of course, children are smaller and infants are smaller. So you can see as we get down with children and infants, you can use one hand, or with the infants, we're doing 2 fingers or 3 fingers, because otherwise the pressure would be too much. So in all of these situations, our goal is to minimize the interruptions to less than 10 seconds. So, checking the scene or switching people that are helping, or going from breaths to compressions. We just don't want to have very many seconds in there, because the compressions are the most important thing to keep the blood going, which keeps the oxygen going to the brain. So you could see the head tilt, chin lift, where we're literally just doing a seesaw, pushing the head back and lifting the chin up. For infants, we don't do it super far because their necks are so bendy, so more neutral. Children, you can go back far, and adults, you can go back far. If we suspect they have a head, neck, or spinal injury, we just try to pull the jaw forward and open and not tip the neck at all. So they were showing in the video the plastic film. That is something that will fit in this little pouch. You can order bunches of them and have them on a keychain if you like. And also, I like this one. I keep this in my car and with all my first aid kits, and you see the lifeguards wearing these. They have the Velcro on the back. So these are very easy to use. They pop out, and these are about $25, $30 from the Red Cross. So very easy to use. You put the triangle over the person's nose, and then when you blow in it, again, it has this filter, kind of dark there, so that it's protecting you from any viruses and bacteria. So we're going to try 2 breaths and look for chest rise. If it doesn't work the first time, you try to reposition the head and airway and try again, and keep a tight seal pressed down on the mask. If it doesn't work the second time, they might have an obstruction like choking or an airway problem. So we don't take any more time. We're trying to limit these interruptions in chest compressions.
Just a quick question, Kim. I know the video said 30 and you've gone back and forth between 15. So just to verify, and this was a question that came in, is one for infants and one for toddlers, or you can do 15 or 30, or could you just clarify that for us a little?
Right. Currently, the rule is 30 with 2 rescue breaths for adults, which is teenagers and above, teenagers and adults. Children and infants, which is anybody under the teenagers, so like 12 and under, would be 15 and 2. The video, though, from Red Cross did still have a 30 in it because they haven't updated their video, because the rule actually just changed in November. They they do this big announcement in November, and then it takes all of December and January for people to update. And I did just re-download that video. I'm not sure why it's not updated yet, so I apologize for that.
No, thank you so much for clarifying. Go on.
Yes, and I'm just saying, I've learned CPR and taught CPR for a very long time. My mom was a CPR instructor for the Red Cross. So I remember 30, 40 years ago, there used to be whole charts of this age, this number, and it was very, very confusing. So they're always trying to make it very simple. And the takeaway is, if you don't remember the number, that's fine. Just do chest compressions. It's better than just standing there worrying about, I can't remember the right number, so I'm going to do it wrong. We would rather you just do anything.
Okay. And then the same on the similar lines, just before you go on, in past, they had said, don't do any breaths, just keep going with chest compressions.
Yeah.
And the question is, are not stopping, is these were more important than rescue breaths? Has that changed for sure? Because I know in the beginning you did say something about rescue breaths. You want
there's a movement too of even teaching, children and teens, like kids, how to do just chest compressions, because that is the most important thing. It's, I would say, kind of 90% chest compressions. There's a small benefit to doing the rescue breaths if you're doing them correctly. if you've never done them before and you don't have a mask and you're worried about it, we want people to just do chest compressions. You can just do them continuously. You know, you can just keep doing them, not even counting, you know, and just try to switch every 2 minutes with someone, or just keep going until a paramedic shows up. The chest compressions is the most important thing to saving a life. So that's what we try to focus on. If people have a chance to practice the rescue breaths, or they have a mask and they're comfortable doing it, yes, you can do the ratio. With children and infants is 15 and 2. But, and you know, they study this, American Heart Association, and like I said, this international committee, you know, they actually study and do, you know, different ratios, and look at all these very specific details, the exhaled carbon dioxide and all this kind of stuff. And they're, like I said, finding just a small benefit. So there wasn't like a huge difference in survival in people that had just chest compressions versus both. So it's not, you know, mandatory, basically. It helps a little bit.
Thank you so much for clarifying, and everyone, great use of the Q&A. If there's anything else as we go on, please let us know. Thank you, Kim. We can keep going.
Sure. So for choking, adults and children, we're going to encourage people to keep coughing. If you hear any noise, whistling, squeaking, coughing, whatever, that means they're still getting air. If you don't have air, you can't make any sound. So if they still are getting air, we're going to just help them. You can call 911 and just encourage them to cough, get in a good position, kind of lean forward a little bit. If they get to the point of no breathing, which is, you know, their eyes start popping out, and people, you know, do this universal sign for choking, and you don't hear anything anymore, then we are officially choking, and you want to come in there and do abdominal thrusts. So that's putting the hand in a fist and the other one over top, and you put that in the stomach, and you've probably seen this somewhere before or seen a video, and we just stand behind them and pull back. For infants, it's a little different with hitting on the back, and then the chest thrusts are just like the CPR, the chest compressions. We're not trying to go down in their stomach, we're up on the bone. So I want to show you the infant part is a little different.
If an infant is conscious but choking, deliver 5 chest thrusts using the 2-finger technique, resting the infant against your forearm and thigh. Turn the infant over and deliver 5 back slaps. Continue alternating 5 chest thrusts and 5 back slaps until the airway obstruction has been removed. Make sure to support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes unconscious at any time, begin CPR.
And you want the head lower than the body. So if you're sitting down, you can just get their head towards your knees and just kind of make sure their head's lower. If you're standing up, you can use your whole forearms and kind of do a lunge and rest the head on your legs. So infants are a little bit different. Just if you can pick them up, if they're that size, you can flip them back and forth. That's more effective to do that. If it's a child that's, you know, a toddler up through adults, we just stand behind them. If they're small, you can kneel. If they're sitting in a chair, you can just come around them. It's like a hug, but you put your hand and then in a fist with that over it, and you're just pushing in their stomach. So we're going to move on to the concussion and head injuries. Last month, we talked about the asthma, allergies, and anaphylaxis. And the important thing to remember is that the leading cause of death with children is injury. So that goes back to our cardiac chain of survival, which the most important step is prevention. Okay, so we're going to pause here and go look at the Red Cross again. So for head and neck. This has a little bit on spinal, which we're actually going to do next month also, but we're going to focus on the head today. You want to look at the mechanism of injury. That's what we call it, and the paramedics and the EMTs are going to ask you first thing, what happened? You know, if a kid is jumping at Gymboree from one mat to another, that's not really enough to give yourself a concussion, falling on a 6-inch mat. But falling off a bike, diving head first and hitting something, anything falling from a few feet, or basically the size of the child, and also falling onto a hard surface. And I have 5 kids. My kids have had concussions, sports injuries, and also my toddler, she's in 10th grade now. She was the one that would stand up in the shopping cart and just like dove backwards. I don't even know what she was doing on the concrete. So she got a bad concussion from that one. Look at the helmet, but don't take it off. If a helmet is dented, cracked, broken, anything from a fall, that's a sign that it's not going well. And then even if they are unconscious, like this picture, so when you run up and say, hey, are you okay? And they're not answering, even if it's 5 to 10 seconds, that's still a loss of consciousness. They are unconscious during that time period. Also, the falling asleep, that can happen too. Like they're awake, but then they fall asleep right away. If it's not a normal nap time for them, that's because of the head injury. So it can look like someone that's under the influence, asking the same questions again, even if you're asking them, what is the month, or what is your name, or can you tell me where you are? You want to try to quiz them a little bit, even if they're like, you're like, yeah, you just fell off your bike. And then a minute later, they're like, what happened? And you have to tell them again. That's another sign that they have a head injury. Pain, of course, and loss of sensation or movement. Bumps, bruises, depressed area. So you'll see when the EMT or paramedics come, that's the first thing they're going to do is feel down each of the vertebrae, so we can tell which ones are different. Okay, anything leaking anywhere, unless it's blood from a cut, that's not a good sign. Bruising right around anything, and it's not where you hit. And then this will be kind of like a migraine almost, like if they get that, oh, that light hurts kind of thing, and they're not normally like that, that's a sign, or definitely a seizure. So of course, any of these happen and it's concerning, you can call 911. If they seem like they're fine and then you go home and then these happen later, you can call your doctor and see what they advise, if they want you to come into the office or go right to the ER. This is a tip here, approaching them from the front so they don't have to turn their head. We want them to stay in the same position. If it's severe and you are waiting for the ambulance, we don't want them to move at all. So when you're asking them questions, especially with a child, we want to make sure that they are saying, make sure you tell them, say yes or no, don't nod your head. We don't want anybody moving their head or neck if they have an injury. So stay in that position. Don't take off the helmet. Okay, if the helmet was ejected somehow, which does happen in bad accidents, even though it was on and it breaks off, they will want to see that at the ER, so you can take that with you. We're gonna come back to that video in a second. If they're out of it and they can't remember what happened, nausea, vomiting, headache, the physical part, I really feel like if you've ever had a migraine, that's what a concussion feels like. You just feel like you want to go kind of crawl in a dark cave and not be bothered. So if that's what your child is doing, that's not normal for them, then you want to be concerned. Irritable, sad, agitated, not playing like normal. Okay. This is basically saying, if you have any questions about it, you just go to the doctor. Don't worry about it. Just go. Okay. So let's go look at this video.
A concussion is a traumatic brain injury that alters the way the brain functions. Concussions can occur anytime a person experiences a bump, blow, or jolt to the head or body that results in rapid movement of the head. Many people who experience concussions do not lose consciousness, or they lose consciousness only briefly. A person who has experienced a concussion may have physical signs and symptoms, such as headache, blurred or double vision, sensitivity to light and noise, problems with balance, and nausea or vomiting. A concussion can also affect the person's ability to think and remember. For example, the person may have trouble following instructions or be unable to recall events that occurred immediately prior to or following the injury. You may notice changes in the person's mood, such as irritability, sadness, or anxiety. The person's behavior may also change. For example, the person may sleep more or less than usual. The effects of the concussion can last for several days, weeks, or longer, depending on the severity of the injury. If you think a person has a concussion, advise the person to stop the activity he or she was engaged in when the incident occurred. The person should follow up with a healthcare provider for a full evaluation if EMS has not been called. Giving the brain time to heal is essential for recovery, and the person's healthcare provider can best determine when it is safe for the person to return to normal activities.
Okay, lots of good stuff in there. So we're going to go back to here. The differences for children, that was kind of your general overall head trauma. That could be for adults also. Of course, it's more difficult in young children if they can't tell you exactly what's going on. Like if you can't say what's the month, what's your name and things like that. Infants and toddlers. So days just standing there, tiring, cranky, sleeping, loss of balance, excessive crying, any change in eating or sleeping, lack of interest in toys, of course, the vomiting and the seizures. So I've coached a lot too, and I work as a medic at sporting events for a lot of different things. And concussions are huge, and they're actually so much more common than we think. And, we know growing up, you would hit your head. I remember ice skating and hitting my head on the ice and like just having this killer headache and seeing double, and everyone, including my mom, being like, you're fine, keep going and all this kind of stuff. And we just do not do that anymore. The problem is one hit to your head is kind of a bruise a little bit to your brain. But that second one, if you continue to do activity or sports, is the one that actually can be fatal. So that's why we do this rest. So you really have to think of a concussion as the brain is inside liquid inside the skull. And when we hit it, it's just bruising that soft material. And so you have to wait. It could be a few days if it's a small concussion. If it's a larger one, it's a few weeks. And you will see all of these symptoms during that time. The time that my daughter, and she might have been 3 or 4, she wasn't even small. Like she knew better than standing up, and she wasn't allowed, of course, in the shopping cart after that. But she got a bad concussion, and she wasn't playing. She didn't want to watch TV. Like it really was this sitting in a dark room for a couple weeks. Like her head just hurt. So it really can go on. And the main thing is to follow the doctor's directions. Let me go here first before we go over the treatment. So things to tell your doctor, you basically are deciding, do I want to call my doctor and ask what to do, or do I just want to go to the ER or call 911? Any of those are fine, because if you call the doctor, if you aren't sure, they're going to ask you a few questions and they'll let you know what you need to do. So if you're watching another child, you do want to know any medications that they're taking, and you want to know what happened, any loss of consciousness, even if it was just a few seconds. So that's something good to remember, and even time if you're there when it happens, so that you can tell the doctor that. Any memory loss, seizures, and then also if you're watching other children to know if they've had other concussions. Those second and third concussions can often be worse than the first one if it's hit in the same spot. Another symptom is like when my daughter got her concussion, she very clearly fell out of the back and hit the back of her head, and then was only complaining about the front of her head hurt. So that's a bad sign, because that means it's knocked around in there. So that's a worse type of concussion than just hitting in one area. So the other thing is too, like if you hit your chin, you're not likely to have a concussion. It's kind of where you hit it too. It does need to be around that brain area, not so much on your face. The rules are just going to be rest. The doctor can give you a list of rules when you check out of the ER or the doctor's office, but it is very similar to a migraine. It's like if you stay still and keep the stimulus down, literally the light and the noise, that allows the brain to heal. And then if you try to do something, think of playing a video game, you're using your eyes, you have sound, you have light, you're hitting all those senses, that will aggravate. And then they're going to say they have a headache. So anytime you have a headache, then you have to cut back the activities. So it's just kind of this roller coaster of following these directions and trying to keep the stimulus really down until they're able to tolerate. And sports are much better now at they have this heads up concussion, which you can see on this video here, that all of like, even where I live, if you're doing even community sports, you have to take a concussion training as a coach so that you can recognize these symptoms. I coach cheerleading, and it's common we're doing stunts and a child to fall even on a mat, but falling 4 and 5 feet and hitting your head, you can get a concussion. So if they stand up and they say, my head hurts, they're out. That's it. Like you can't practice anymore until you go see a doctor and get cleared. And then they do gradual return where you can come back to half, play, or you can come back but not do any, impact things. So you could come back and do drills or stretches, but you can't do any activity. So you just want to make sure that you're taking the child to the doctor and that you're getting instructions and following those instructions. Here's the piece on prevention. So these are the most common places that kids are going to get injured. So having gates at the top and the bottom of the stairs prevents those falls from the infants and toddlers. Using the correct car seat for the age and weight will help in car accidents. Helmets, always the right helmet for the right activity, and only using playgrounds that have the good surfaces. So if you find an old playground somewhere with the dirt or the grass, you just want to pass on that and find somewhere else to go. So the CDC has great information on this. If you want more information, they have, how to check your helmet, how to check your car seat, like all the information on how to find anything that you need about this. So let's take a look at, these are the absolute worst danger signs, like call 911 immediately.
Call 911 or take the athlete to the emergency department right away if after a bump, blow, or jolt to the head or body, the athlete exhibits one or more of the following danger signs. One pupil larger than the other, drowsiness or inability to wake up, a headache that gets worse and does not go away, weakness, numbness, or decreased coordination, repeated vomiting or nausea, slurred speech, convulsions or seizures, inability to recognize people or places, increasing confusion, restlessness, or agitation, unusual behavior, or loss of consciousness. Even a brief loss of consciousness should be taken seriously. 911.
So here is an overview of all the CPR, the chest compressions, rescue breaths, choking. AED, we haven't really looked at, but there's going to be a big button that's green or says power, and you turn it on and it talks and just tells you what to do. So if you ever need that, you can just follow those directions. So I want to show you our website, and this is the code that you're going to use, and you can check out, let's hear. So you go to savealife.com, which is hosted by nhcps.com, which is National Healthcare Provider Solutions. So I will put that in the chat in a second, but you can do our CPR course for free. If you put that in your cart and go to check out, you just have to find right here where it's, put the code in, which is helper CPR, and it will come down to 0. You do the course, you can get your certification after you take the test. It's good for 2 years. At the end of your test, when you pass, you can get a digital certificate that you can download, you can print, and so you can then say you're CPR certified if you go through the course. If you want one mailed to you, that's the only thing that would cost money for them to mail an actual card to you. So I want to show you the course. You just, once you have it in here and you are taking it, it has all of these modules: first aid, medical, which is like diabetes, asthma, the injuries. We've covered a little bit of that, environmental, like heat stroke or frostbite, and then adult, child, and infant, CPR, AED, and choking. There's videos for all of these, and then at the end, you take the exam. You need an 80% to pass the course, but you can take the exam as many times as you want. You can go back and look things up, come back later, that kind of thing, if you need to practice more. We do have the courses for healthcare providers on here with practice tests, mega codes, algorithms. This mobile app is great. This is free. You can get this on your app store, and has all the information on there, so you can look up the breathing rate or a first aid symptom. You know, you can actually use it in an emergency, or you can just use it to practice. And then we do have ebooks on here. These are all like 50 to 100 pages. You can download the CPR book and you can print it out and have that as a resource. And we also have some in Spanish down here also. So I can put that. Yes, you have the code, and it's nhcps.com. It's National Healthcare Provider Solutions.
And so thank you so much for putting that in there. There are quite a few questions.
Yeah.
We want to be mindful of everyone's time. Is that course self-guided, or you can do it whenever and bit by bit?
Mhm.
Perfect. And then kind of going back to concussions, that's where we started off last. Do the concussion symptoms tend to show up immediately after the concussion happen? If not, do you have any suggestions how long we should watch out for these symptoms, or is it dependent on the activity or any?
Yeah, it's a very good question. And unfortunately, the answer is both. So you can have, if it's severe, you're going to know right then, like they're not going to be moving, or, you know, they're unconscious or something like that. And again, working at events, I've seen what looks like a terrible head injury falling off of some equipment, and they don't wake up right away, but then they wake up and they're fine and they want to keep competing. And then, you know, we have to figure out what to do with them. And so while I'm watching them and just taking their blood pressure, and then it's like 10 minutes later and they seem fine, they're telling me their name and all this. And then I might just say something casual again, like, oh, what's the date today? Or like, what day of the week is it? Just something very easy. And then they're like, you know, and they like can't come up with it. So there are definitely things that they can seem fine, and then it's bad later. And I've definitely heard, you know, stories of a, you know, child falling at a playground and, you know, falling asleep and not waking up and things like that. So it's a good like 24-hour period of really watching them. And it does go by the mechanism of injury. So like if we see that they have fallen like their height. So a 3-foot tall person, if they've fallen 3 feet and hit their head, not just they're standing on the ground and hit their head, but they have to fall like from their feet up that high. That's kind of what we go by. So like an adult, we would need to fall from 5 or 6 feet like onto our head to get a good concussion. But you know, you're going to watch them that whole 24-hour period. And if you see that, even if they get up and they're like, I'm fine, my head doesn't hurt, you basically need to cancel like what you're doing, not do any more activities that could cause any head injury. Like if you were riding bikes or swimming or just any physical thing, you know, you just go home and like do a couch day and just kind of relax. And then you're going to watch them, because if they throw up like 8 hours later out of the blue, that's from the head injury. So you do have to watch. You know, if you've gone the 24 hours and nothing has happened that's been on this list, you know, that's fine. There's really not, it's not going to come out much later than that.
Okay, very good to know. And then again, backing up, is there, I don't think there went over a specific appropriate choking technique for toddlers. You know, when you can't.
Yeah, that one includes the adult. They only do a different one for infants. So I do like, if I can hold, where's my infant baby? If I can hold them like in my arms, then I'm going to do the infant one where I hold the neck and you're putting this, like splitting on the legs on here so that I can put the head down and do the back like that. And then I'm doing like this sandwich on their neck to flip over, and then the legs are going to come up here and I can do this and have their head lower. So if they are too big for that, you know, like they won't fit on my forearm basically, then they're going to be sitting up on my lap and I'm going to do a fist with my hand over it and just pushing up like that.
Perfect.
So anybody older than that is getting that.
Is getting the adult or the older one.
Yeah,
Perfect.
just the stomach one. Yep.
And then do you use a defibrillator on pulse or no pulse or both?
Yeah, defibrillator is not if you have a pulse. The defibrillator only works with 2 heart rhythms, and it's called VTAC and VFib, and those are heart rhythms that do not have a pulse. So if you put the pads on according to the pictures and then the machine says analyzing, so you just kind of wait a second for it to figure that out, it will decide. But there is no harm at all in putting those sticker pads on, even on a breathing person. Like nothing will happen. Like it won't try to shock them in the wrong rhythm, which is what's so great about them. It does all of the figuring out, like you don't have to figure that out.
Perfect. And then someone asked, in the moment of urgency, which I agree to, when you're caught up in the moment of urgency, I'm not sure I can remember how many inches we need to compress. Any rule of thumb to show how hard we need to press? For example, is pushing harder better than pushing too little, or vice versa, either one?
Yeah. And, you know, I tell people too, nobody is getting out a ruler in the middle of CPR and like trying to figure this out. So we try to just look from the side and you're guessing a third. So basically a third just means we're trying to not go past a half, and it is better to go harder because we are thinking of pushing this bone, which is pushing the heart, you know, and the heart is not pumping, it's just sitting there. So we want to push the heart. And the risk is if we do it just kind of lightly, we're not pushing any kind of blood around. So you really have to think, am I pushing this heart? Am I pushing the blood out? I want the oxygen in the blood to go up to the brain. So it just goes that the bigger you are, the harder you have to push. So, you know, adult males, or if we get people like over 200 pounds, we're just really going to be putting like all of our weight and just using your whole body and your shoulders. We do put, you know, pretty much everybody on the ground. You can do an infant on like a table or something just to make it easier on you, but pretty much everybody else is going to be on the ground. So you're kneeling and you're really putting your body weight into it. And even when you take a CPR class in person and they have you do CPR the mannequin for 2 minutes, it's exhausting. You know, it's like a thing
It's a
that we
lot of work, yeah.
do normally in exercise. It's kind of like a weird thing to do. So it definitely feels like you've been doing it a really long time, and it's only 2
Will
minutes.
you hear bones crack? I've heard of like people saying they
Yes.
hear
Mhm.
ribs crack while you do it, not to be alarmed kind of thing.
Exactly. Yeah. That unfortunately is a casualty, and that's something that people worry about. Oh, am I going to hurt them? Well, if we do nothing, they are not going to breathe again. So waking up and having a broken rib is better. So you just tell people not to worry about it, even though if it happens, and it will happen, you know, it's really going to be, you know, jarring, but it happens to, you know, paramedics too. And it's more the older or elderly, like once we start having osteoporosis and things like that, that are gonna crack a rib. Not so much children.
Perfect. And then one last, what do you have any opinions on the dechoker or the life vac, as they're kind of a pricey item, or any recommendations there?
Yeah, I don't have any experience with them at all, so I would say no opinion.
Anybody
I
that
don't
in your, no?
No, like, because I have, you know, I work with paramedics, and I have a lot of friends that are paramedics, and I don't know anybody that's using them.
And no one's like recommending them for like novices at home just to have on hand.
No. Mm-mm.
Interesting. That's interesting to know. That's good to know that maybe they're not worth the money. Okay, those were a lot of our questions. I want to be mindful of everyone's time. Again, Kim is here every month with Helper, and we were so grateful for all of her knowledge. And there's a self-guided course with the code Helper CPR to get those certifications as well. And any last minute things you'd like to add, Kim or Becca?
Yeah, I'm good.
We will have the April calendar up today online, and Becca shared another link with the PDFs for all of our April offerings. So please make sure you check that out. And anything else, Becca?
No, that's it. That's great. I so appreciate it. Kim, this is a really great session. Judan, it's so awesome to have you on board. This is a really great Q&A too. So I appreciate everyone's time. And as Judan mentioned, the link is really helpful for just looking through event details, descriptions. There's definitely a lot of information on there with kids free programming too. So thanks everyone.